The number of COVID-19 cases worldwide jumps 18% in just a week. Here to explain why is Dr. Helen Boucher, the interim dean of Tufts Medical School and an infectious disease specialist at Tufts Medical Center. Thanks for being with us, Dr. Boucher.
Great to see you, Dr. Boucher. Thank you. So the World Health Organization says that infections are increasing right now in 110 countries. So a simple question, but what is driving the surge in your opinion?
Yeah, well, we know there are a couple things happening, Ed. So BA4 and BA5 variants have exploded across the world, which is a problem. And then in especially poorer countries around the world, we still have unacceptably low vaccine rates, only 5.5% in the poor countries. So we have a very vulnerable population and a very transmissible variant of virus happening.
Yeah, well, so you mentioned them, BA4, BA5, and we know they account for about 70% of new COVID infections here in the U.S. What's the impact of those specific subvariants and how have hospitals been grappling with them?
Well, so far we're seeing a mild impact, about a 12% increase in hospitalizations, and fortunately a very low impact on deaths so far. But the concern is with this highly transmissible variant that we will see an increase, and I hope it just won't be a significant one.
Dr. Boucher, can we talk about the avian flu for a second? There's an outbreak that's already killed hundreds of local seabirds this summer. Now we're learning the virus may be linked to dozens of dead seals in Maine. What can you tell us about the health risk to humans?
Well, fortunately, the health risk is low from this bird virus, right? But we have seen that it's already jumped into another species of mammals in seals. So it's very important for us humans to avoid any sick appearing bird and to make sure that we wear gloves and wear a mask if we have to handle such a sick bird.
Okay, well, speaking of sick birds, this is some good news. At least Massachusetts has found 0 cases of avian flu so far in backyard chickens and the like, but there's always this risk. So what are ways, you mentioned kind of protecting if you need to handle a sick bird, but what are some other ways families can protect themselves?
It's really important not to approach a sick appearing bird. And I think that anytime you handle a bird, a chicken, it's very important to have really good hand hygiene, to wash your hands well, and to just be careful with anyone who's immune compromised or very old or very young in such a setting.
Dr. Boucher, thank you so much for your time and your expertise. Great to see you.
You too. Thank you.
Take care. Bye-bye.
Thank you, Dr. Boucher. To our viewers, if you have any questions that you'd like our experts to answer, just email them to ask@wcvb.com.